Hey guys, this is Nicholas from the Center of Dental Professionals. Today here talking to you about how to set up for a basic treatment tray. In most offices or most places, the dentist office is called a filling station. So here we are at the filling station. So for your tray, what you will need is a Q-tips. These are to get topicals. You have your dry angles. It goes in the back of the cheeks to help keep the cheek away from the teeth and also keep the teeth dry. You have your 2x2s for wiping off your dentist instruments. You have a cotton roll, usually goes on the bottom under the tongue to help keep the tongue away from the teeth and help keep your teeth isolated. You have your air water syringes, saliva ejector, high volume suction. For your anesthetics, you have a long and a short 30 gauge and a 27 gauge based on the doctor's preference. Your most common anesthetics, Septicane and Lidocaine. Again, that's also based on your doctor's preference. You have your anesthetic syringe holder, mirror, an explorer, a spoon excavator. The spoon excavator, once the doctor cleans out the teeth, they usually use this to go in, check and make sure that all the decay is taken out and everything is removed. You have your ball burnisher. When the doctor packs the composite, he usually uses the ball burnisher to make sure to push down on the composite to make sure it fills in all the groove and crevices. You have an acorn burnisher. It does the same thing. You have a plastic instrument on the end. It looks like a beaver tail, so some doctors call it a beaver tail. This is for mostly for the anterior teeth. You also have an articulating paper. This is to check the bite and make sure the patient is not biting too high. You have an articulating paper holder, cotton pliers for picking up your cotton roll. You have a spatula for mixing materials, and then you have a wooden edges. This is for interproximals. When you're doing a mesial or distal, the doctors usually use this to make sure the contact is really tight. You have your articulating, you have your matrix bend, some bite blocks, etch, burr block, slow speed and a high speed. You have your primer, your composite gun, and you also have your micro brush for picking up the primer to put in the teeth before you put on the composite. Thank you so much for taking time out of your day to watch me next on how to become a better dental assistant. Please stay tuned for more videos coming in the next few months to help you grow and also expand on your knowledge.